Dr. Lilian Nawire is the president of the Federation for Uganda Medical Interns. Her lot, comprising 1,400 interns, complete their rotation on the 8th of February 2022. Dr. Nawire works with Masaka Regional Referral Hospital. She says her typical work day is hectic and involves doing ward rounds when she arrives at 8 a.m.
Must make sure to follow up all my patients. How are they doing today? Did they do the investigation they need to do? How are they feeling? Is there anything we can change? Is there any side effects that medication caused them? So there are times when wards have 50 patients, one ward. So if you combine that two, you're having 30, that's average. You have 60 patients in a day that are just on the ward. You've not seen these ones that are coming outpatient and go back.
She says whereas there are senior medical officers at the hospital, the burden to ensure smooth running and providing medical services almost entirely rests on their shoulders.
For example, patients that need blood, a medical intern is responsible for drawing off the blood, go test the blood type. You see the patient, see what they are suffering from, know the investigations you need, take off the blood, run to the lab, take those investigations there, wait for the results, or go back later, look for those results, get them back, come review them, and now see what medication you're giving your patient. There are cases that medical interns operate on without a senior, but there is no case that is operated on without a medical intern.
Their shift schedule mandates them to work for 8 hours, but Nawire says they work overtime because of the shortage of health workers.
You're not going to find a senior in the hospital 24/7, but a medical intern, it's my duty to be in the hospital 24 hours in a day. That means that if I'm going away from the hospital, I must have someone covering me. Because it's my responsibility, my patients are my responsibility, and we take that seriously.
Nawire says they have problems with remuneration and lack of equipment.
When you see me with the stethoscope, a sensible one, and that BP machine and all that, stethoscope alone, just the one you put here, at least one sensible one is 400K and above, You look for these machines. The hospitals don't have these things. They don't give them to you. You come, I need to test your blood sugar, and an intern, you don't have a glucometer, how? You must have those things. They're expensive.
A medical intern earns 750,000 shillings per month. This money, according to Dr. Nawire, is for their upkeep, but insufficient because government does not provide for them as they are supposed to.
Because already 450 is going to lunch to meals. So on the 750, you're running with 300. Now you have to rent. You're already looking for 300 or 350. You have to dress yourself. You have to transport yourself, every day to work. You find some hospitals, like for example, my hospital, Masaka, there are 64 interns, but there are only 10 rooms. So only 10 interns actually have where to sleep.
The medical intern adds that for this reason, some of her colleagues have ended up in unbearable situations trying to improvise and live on the 750,000 shillings allowance. The industry action by medical interns is in its 5th week. They say they will not relent until their demands are met. They are scheduled to meet with government officials on Friday to discuss the impasse. Mwesigye, NTV.